Okay, thank you all so much for being here today. My name is Jordan Goldberg. I'm the Director of Policy at the Primary Care Development Corporation. We're a nonprofit organization founded 30 years ago, based in New York State, but we work all over the country and statewide to expand access to high-quality primary care for underserved communities all over the country. We're here today to urge the legislature to pass Assembly Bill 8592 and Senate Bill 1197B, the Primary Care Investment Act, and we're joined by several legislative champions of this legislation who understand that primary care is so critical to our state and to the people here. And I'm just gonna hand it right over to Health Chair Assembly Member Paulin, who's gonna talk a little bit about this, and then to Senator Rivera. Thank you.
Paulin. Thank you. So we always say that if we had more primary care and people learned at an earlier stage about their health diagnosis, that we would save lives. And we know that to be intuitively true. We know that to be practically true. But we don't have hard data about what's happening out in the world to make that a reality. This bill that I share with the senator over here to my left is the bill that would make that happen. In order to drive our health institutions to make that happen, we have to first tell them and tell us what's going on out there. To call attention to the facts that we know, that primary care makes a difference to people's lives. So the health plans would be required to give us that data, and then we could see where we're at, and we know then the tools that could be used, and that's also specified in the bill, financial tools that can be used, and we would know where to apply them and how to get better outcomes for people. So the bill is critically important. Yes, will it put an additional burden on insurance companies? But the additional burden would make them do the right thing and allow us to push them in that direction. So it's a very important bill. Thank you.
Thank you, madam. And as my colleague makes her exit, primary care is essential. Unfortunately, we don't spend enough money on it. And that's really what we're talking about. It is something that is not only less costly, but would certainly lead to a lot of less costly things down the line. It would lead to better lives for individuals, better lives for communities, healthier lives for communities and individuals. And so this bill that I have with my colleague in the Assembly would actually require that over a certain period of time, you hit a certain percentage of the total amount of dollars spent, they should go to primary care. And this is what is called not a spend, but an investment. It is an investment in something that, again, is essential. If we identify chronic conditions earlier, we can make sure that they get treated. If we get someone to get somebody to tell them the things that they need to do to keep themselves healthy, they can be healthier for longer. All of this we can do by requiring that a certain percentage of this money that we spend every year is spent on primary care. So we've passed it, we've moved it before in the Senate, and I'm working this year to make sure that we do that. And I'm working with my colleague in the Assembly to make sure that we get it done over there. Because at the end of the day, certainly I know this from the examples that I see in the Bronx and the lack of access that people have there. They would lead better lives, they would lead healthier lives, they have more access to health care, but they have that more access to primary care. So this bill will make it so that we actually spend the money where we're supposed to. Thank you.
So as our champions have said, primary care saves lives, leads to better health for both people and communities, and is absolutely central to health equity. And I'm joined today by a number of really helpful healthcare providers who can tell us a little bit more about what this means for their patients and what this means for providers. So I'm going to hand it over now to some of New York's most who have the most primary care provided in their clinics, who know what it's like to try to provide high-quality primary care despite these challenges. So we're going to start with Marie Manjan from the Community Health Care Association of New York State, otherwise known as Chicanis.
Thank you, Jordan. Hello, my name is Marie Manjan. I'm the Vice President of Policy at Chicanis. Chicanis is the statewide association representing all of the state's federally qualified health centers, which serve underserved communities in every corner of the state. Over 2.3 million patients are served at health centers. And what those patients, providers, and clinics know is that the current way we fund our healthcare system in New York is not working. It is not working for providers, it is not working for our workforce, and it is not working for our patients. The Primary Care Investment Act will require New York to rethink the way it allocates resources. Chicanis conducted analysis just that year, which found our health centers provide care over 40% of their costs are higher than what they are reimbursed by Medicaid. This is a striking underinvestment in our safety net communities and in our communities of need. We're thrilled to be here today with other advocates standing alongside Senator Rivera and Assemblymember Paulin, our champions, who are calling for an investment and a new way of looking at funding the primary care system in this state. Thank you.
Thank you so much, Marie, for that important perspective and for everything Chicanis does to support communities. Next, we'll hear from Patrick McGovern, the CEO of Callan Lord, which is a federally qualified health center down in the New York City area. Patrick?
Thank you. I'm the proud CEO of Callan Lord Community Health Center. We serve the LGBTQ plus communities throughout New York City. We have clinics in Brooklyn, the Bronx, and Manhattan, serving over 20,000 people. I can give you one statistic that sums up why this legislation is so important. 42% of our patients have commercial insurance, but only 7% of our patient revenue comes from commercial insurance plans. This demonstrates just how completely underfunded the commercial plans are with primary care. We know that primary care works. It's preventive, it saves money, and it saves lives. But our health system continually overinvests in the downstream problems instead of the upstream solutions. We overinvest in emergency rooms. We overinvest in patient stays. We underinvest in primary care, preventive care that saves lives and saves the healthcare system money. That's why this bill is so critical and urgent. Thank you.
Thank you so much, Patrick, for that perspective and for what you do at Callan Lord. Our last speaker will be Vito Grasso, who is the CEO, I hope I got that right, of the New York State chapter of the American Family Physicians, and he can speak about his patients and his members.
Thank you, Jordan. I am Vito Grasso, CEO of the New York chapter of the American Academy of Family Physicians, and we support this legislation because family doctors and their colleagues in primary care specialties across the spectrum of medicine are the front line of healthcare. We see a third or more of every visit to the healthcare system is funneled through the primary care system. We know that there is a great deal wrong with our healthcare system, and if we are to be serious about reforming it, we have to begin with a greater increase or greater investment in primary care to utilize the benefits of the primary care system to provide prevention, to provide appropriate and accurate diagnosis, and to funnel people into the treatment that is most effective for them given their history and their diagnosis. So we believe that this legislation is important because it will help us acquire information that we certainly don't have but is critically necessary in beginning that process of reforming our healthcare system and appropriating resources, allocating those resources more appropriately so that they can achieve improved outcomes, more efficient care, and can support growth rather than retraction in the primary care workforce. So we're very grateful to Senator Rivera and Assemblywoman Paulin for their leadership in introducing this legislation, and we strongly support it and encourage the legislature and the governor to enact it.
Thank you so much, Vito. This is important legislation that would make a difference to New Yorkers, both for their own health and the broader community. And New York would be far from the first to take this step. At least 17 states have already started to take steps towards increasing investment in primary care, recognizing that it is the best way to move towards health equity for all types of communities and to support community health. And it's time for New York to do the same. Thank you for your time.